Hi friends, I am Dr. Vindhiya. Today we shall see regarding an important problem, that is a constipation in children. Constipation is a very common problem in children. Constipation means change in the consistency or frequency of the stools. So normally a child should form well-formed soft stools. If the baby is passing a hard, a dry or a pellety stool, that is constipation. Coming to the frequency of these stools. So babies might open up the bowel from few times in a day to once in few days. Both aspects are normal. So in the normal breastfed babies, initially they passes motion after every feeding. But certain babies, they may pass stools once in few days. So we say up to 1 week it is normal in a breastfed baby, because breast milk itself is an excellent laxative and it forms a soft stools. Rather than the frequency of stools, what is important is the consistency. So if the child is able to pass stools without pain, that is fine. But if the child is passing the stool with the pain, then that is a constipation. So to say it simply, if the child is able to pass the stools regularly without any difficulty, it is normal. But if there is a change in the consistency and the defecation is painful, then it is constipation. So there are many causes of constipation, but the important ones are faulty feeding. Constipation is very unlikely in children less than 6 months of age, as the baby is predominantly on breast milk. Whereas when we introduce the complementary feeds, if we don't introduce adequate fluids and fiber, the child's motion becomes more hard and bulkier. So that is when they tend to get constipated. The second is withholding. Why the child should withhold? So child withholds the stool because once the stools become very hard, it is a painful process to defecate. Hence, child avoids the urge to pass the motion and tends to hold. If the child is busy playing, he tends to postpone the bowel habit. The third is if there is a change in the environment. That is, if the child starts using the public toilet, school toilet, which is not as clean as it is at home, then they tend to avoid defecate in those toilets. Change in weather, stress or any travel can affect the bowel movements. Early toilet training. If we to toilet train the child early means if it is less than 1 year of age, child may become rebellious and he may tend to postpone the bowel movements. So it is ideal that you start toilet training after 2 years of age. So when to seek a medical attention? See, constipation can easily be treated. It is not a distressful situation. But if you allow it to continue, it may become a important problem in the future, causing chronic constipation. So it is always better that you seek medical attention at the earliest. So what are the important symptoms? If the child is having tummy ache, child is complaining of pain while passing motion, if there is blood in stools, if the child is having refusal to feeds, if you notice there is a weight loss, or you notice that the child is having soiling with the feces. That happens when the child is chronically constipated, there is motions that is present in the underwears. Also, sometimes you may have a mass that may be seen outside the anus, that is called as prolapse. So due to the pain, child withholds the motion. So that can be manifested as child may go in the corner of the house and he may crisscross the leg and avoid the urge to defecate. He may hold on to furniture, pulling the motion up, or he may have a red face because of the painful defecation. So before the child develops these important complications, it is always better to seek the medical attention at the earliest. So how to prevent constipation? We all know prevention is better than the cure. So what we should do? We have to make an important change in the diet. When you start the complementary feeds, apart from introducing the carbohydrate, we should introduce fiber diet. So where do you get fiber? We get it from fruits and vegetables. So among the fruits, the important ones are peas, that is prunes, peaches, papaya. All these are very high in fiber content, help in digestion and passing motion easily. In the vegetables, the green leafy vegetables are very important. Your beans, spinach and drumstick leaves, these are very important to be introduced in the complementary feeds. Then child should take adequate fluids. So fluids can be either you can give the fruit as raw or as a juice, or you should at least the child should take 8 to 10 glasses of water in a day, depending on the age of the child. The third is physical activity. So child should have adequate physical activity so that it helps in digestion and the motion is passed easily. Fourth is toilet training. So we should not introduce the toilet training very early, that is less than 1 year. Maybe after 2 years, we can do the toilet training. We should ask the child to go to the toilet at a particular time and instruct the child to pass the motion. You can also try making the child squat, whether it is an Indian toilet or it is a Western toilet. The child should squat so that he passes the stool easily. The another thing what you can do is the tummy massage. Tummy massage is you put your palms over the baby's abdomen and then you move it like a clockwise direction. So this massage stimulates the bowel, may enhance the bowel movement, stimulating the baby to pass the motion easily. So in the treatment we have laxatives which softens the stools, and this has to be given for a longer duration of time. But as we are continuing to give laxatives, the important thing, we should modify our diet, we should enhance the physical activity and make the child squat to pass the motion. So this can be done by using footstool at home. இந்த வீடியோ பிடிச்சிருந்தா லைக் பண்ணுங்கள், ஷேர் பண்ணுங்கள், கமெண்ட் பண்ணுங்கள், சப்ஸ்கிரைப் பண்ணுங்கள். மறக்காமல் அந்த பெல் ஐக்கனை அழுத்திடுங்க. தேங்க்யூ.